Ma'am, I'm suffering from a genetic disorder and I don't want my offspring to suffer from the same disorder. Do I have any option? Is there any solution for that?
Subscribe to our YouTube channel and press the bell icon so that you don't miss any important updates related to infertility.
Hello everyone, I'm Dr. Srishti Jaiswal from Indira IVF Alambagh Center, and today I'm going to talk about PGT, Pre-Implantation Genetic Testing. So yes, if a patient is suffering from genetic disorder which is hereditary, or if the patient's age is advanced, or if the patient has a lot of miscarriages, in that case we can go for pre-implantation genetic testing of the embryos. So what we do is we do IVF, we make the embryos, and then we take a single cell from that embryo and do the genetic testing of that to rule out any hereditary disorders, any genetical disorders, any chromosomal disorders in that embryo, and then we go for implantation of that corrected embryos. So basically you can always select IVF and go for pre-implantation genetic testing in case you have any genetical disorders. Thank you.
For more information, visit our website www.indiraivf.com or call 1-800-309-4410. Keep following us and leave your fertility-related questions in the comments below and get answers from Indira IVF doctors.